Welcome to day 5 of ACULIFT Cosmetic Acupuncture. The next 3 points that we shall talk about for needling the eyebrow will have to use 6 mm intradermals. It is best to insert them with tweezers. The type we recommend are those with a slanted tip and a wide handle grip. We find that these are the best to master this technique. By raising the eyebrows in this step, we will naturally lift the eyelids too. When needling any of the 3 eyebrow points, do not be afraid to lift the brow as much as possible. You need to be achieving a startled look when you have finished inserting the needles. YUYAO, fish waist, is located directly above the pupil in the eyebrow muscle at the top of the orbicularis oculi where it meets the frontalis. Functions: enhances eyesight, activates the vessels, relaxes tendons, and reduces edema. Applications: oculomotor paresis, eye tics, and eye disease. YUYAO is an extra point that is located in the middle of the eyebrow. We are using this point to help raise this area. Interestingly, YUYAO was reported by the Shanghai First College of Medicine as an anesthetic point for use in minor surgery to the forehead, eyebrow, and temple regions. This can only serve to continue to lessen any discomfort that may otherwise be felt when we work more closely on these parts of the face. Needle size: 6 mm intradermal. Technique: to needle this point, lift the eyebrow as you do so and pin it in place. This extra point is one of the most sensitive points that you will needle on the face, so extra care needs to be taken when working on this area. BLADDER 2 Zanshu Collect Bamboo. Location: in the depression at the medial end of the eyebrow. Muscle: frontalis and corrugator supercilii. Element: water. Functions: clears heat, eliminates wind, enhances eyesight, and alleviates pain. Applications: eye diseases, sinusitis, headache, neck pain, and stiffness. BLADDER 2 is a really good point for benefiting the eyes and also the sinuses. We are using it predominantly as a lifting point to raise the medial end of the eyebrow. The underlying muscle is the corrugator supercilii, which is responsible for the vertical frown lines on the forehead. Targeting this point helps to tighten the muscle to prevent these lines from forming. Needle size: 6 mm intradermal. Technique: lift medial end of the eyebrow with the forefinger of your other hand and needle with intradermal, pinning the brow in upward direction. This point refreshes our physical and mental faculties. Can be considered as an alternative to or supplement for BLADDER 1. For sinusitis, hay fever, or eye problems. Clears the nose and head. Consider for headaches, particularly around the eyes. The eyebrow resembles a bamboo leaf, hence its name. Triple Heater 23 CHEEKBONE Silk Bamboo Hollow. Location: lateral end of the eyebrow in the depression on the supraorbital margin. Muscle: orbicularis oculi. Element: fire. Functions: enhances eyesight, alleviates pain, expels wind, and clears heat. Applications: eye diseases, eye tics, one-sided headache, toothache, deviation of the face and eye. Needle size: 6 mm intradermal. Technique: Triple Heater 23 should be tackled in exactly the same way as the previous 2 points. Again, raising the brow as the intradermal needle is inserted. This point can help the triple heater restore a sense of equilibrium to a person in cases of unbalanced temperature or mood, and to enhance its role of guarding the spirits against perverse influences. A local point for one-sided headaches, migraines, facial paralysis, and many eye disorders. It is said to contain a hidden quality, just as bamboo contains its flower within it, and the connotation is of a way to take quality and warmth within a person. Jaw points. These are 6 extra points that we use on either side of the mandible to tighten the jaw line. Location: find stomach 5, Ta Ying, or Great Welcome, which is 1.3 tsun anterior and inferior to the corner of the jaw on the front edge of the masseter muscle. The first point is directly below stomach 5 with 1 point approximately 1.5 tsun either side. Muscle platysma. First, locate stomach 5 and choose a point directly below it and 1 point symmetrically either side of this needle. Effectively, you will have 3 points under the mandible bone at 1.5 cun distance between each point. These are not acupuncture points. Needle size 25 by 0.16 mm, gauge 40. Technique: apply downward pressure and tuck skin under the jawbone as you needle midpoint. You are pinning flesh under mandible bone. Repeat this procedure with the points either side. Needle the jaw in this way on both sides of the face. Over time, this part of the treatment will train the muscles in the jowl to tighten and encourage a more angular shape to the patient's jawline. Cheek point. Again, locate stomach 5 and palpate above this point 1 to 2 cun in measurement, then 1 cun back towards the ear and into cheek muscle. Needle size 25 by 0.16 mm, gauge 40. Technique: needle this extra point with insertion towards the ear. When needled correctly, there should be a grabbing sensation as needle enters the cheek muscle. If this is achieved, you will notice how the area we are working on tightens up almost immediately. This is a very important point that can give very dramatic results, so it is worth practicing your needle techniques on this point. Needle bilaterally, angle 45 degrees to cheek. Stomach 4, DICANG, Earth Granary. Location: 0.4 cun, lateral to the corner of the mouth, directly below the pupil. Muscle: orbicularis oris, risorius, and zygomaticus major. Element: earth. Functions: expels wind, activates the channel, and alleviates pain. Applications: facial paralysis, deviation of the mouth, toothache, neuralgia, and night blindness. Stomach 4 often lies at the base of the nasolabial fold. We are using stomach 4 purely for its location at the side of the mouth, as we are angling it up into the underlying zygomaticus major muscle, responsible for raising the smile. Stomach 4 is also a common point used for facial paralysis and was selected for the aforementioned study into treating Bell's palsy. Stomach 4 is a major point for the mouth and face. The deep pathway encircles the mouth and connects to REN24. It can help in cases of indigestion, eating disorders, facial paralysis, trigeminal neuralgia, or deviation of the mouth. The stomach is the granary organ. It receives and stores the 5 grains. This point can be indicated for someone who has no sense of their own harvest, helps the body, mind, and spirit to receive nourishment and satisfaction. Large intestine 20, LINGXIANG, welcome fragrance. Location: level with the lateral part of the nasal wing in the nasolabial fold. Muscle: levator labii superioris. Element: metal. Functions: opens the nasal passages, expels wind, and clears heat. Applications: deviation of the mouth, facial paralysis, rhinitis, nosebleed, facial edema, and facial itching. Large intestine 20 is a local point for swelling, paralysis, and itching of the face. The point is located at the top of the nasolabial fold, which covers the levator labii superioris muscle. Points along the large intestine channel are used to detoxify and improve the complexion. Needle size 25 by 0.16 mm, gauge 40. Technique: needle bilaterally and using Evans technique. This is the first point that we use to begin to lift and shape the cheek. LI20 is exit point, crossing point of SI and LI, which together form the Yang-Ming channel. This point can resolve or enhance a patient's diminishing sense of smell. It is said to work on a higher level too, welcoming in new experiences whilst enabling a person to recall old ones without living in the past, for sinusitis, hay fever, or rhinitis. Consider for facial paralysis, trigeminal neuralgia, eye disorders, or digestive symptoms. It connects to stomach. Stomach 3, YUYAO, great cheekbone. Location: directly below the pupil on the lower border of the ala nasi. Muscle: levator labii superioris and levator angular oris. Earth element. Functions: enhances eyesight, expels wind, and activates the channel. Applications: mouth and eye deviation, sinus pain, swelling of the lips and cheeks, and facial paralysis. This point is used in conjunction with LI20 and SI18 to shape and contour the cheek area. The levator angularis oris is a muscle that underlies the levator labii superioris, and this is triggered when needling, helping to lift the face. Needle size 25 by 0.16 mm, gauge 40. Technique: this is the second point used to shape the cheek area, and it is needled perpendicularly and bilaterally using Evans technique. Similar in effect to ST2, but can also be used as a local point for a swollen jaw, spasm of the facial muscles, facial paralysis, or toothache. Connects to DO26 and encircles the mouth. Small intestine 18, QUANLIAO, cheekbone crevice. Location: in the depression below the zygomatic bone, directly below the outer canthus. Muscle: zygomaticus major. Element: fire. Functions: alleviates pain, activates the channel, returns to correct position, and relieves cramp, expels wind, and reduces swelling. Applications: facial paralysis, facial cramps, deviation of the mouth and eye, facial pain, and toothache. Small intestine 18 is used in conjunction with stomach 3 and LI20. Aside from its outlined functions and applications, needling this point has an effect on the zygomaticus major muscle in order to lift the face. Needle size 25 by 0.16 mm, gauge 40. Technique: the third location forming the triangle of cheek sculpting points. Needle bilaterally using Evans technique. Crossing point of SI and triple heater. Consider for Bell's palsy, facial neuralgia, tic, or blinking eye. Also for tooth and jaw problems. Stomach 2, SIBI, 4 whites. Location: in the depression of the infraorbital foramen, one zone directly below the pupil. Muscle: orbicularis oculi. Element: earth. Functions: enhances eyesight, clears heat, and expels wind. Applications: eye diseases, headache, night blindness, and deviation of the mouth and eye. Stomach 2 is located on the orbicularis oculi muscle. Locate the point, gently press your finger to it, and tightly squeeze your eye shut. This muscle is responsible for closing your eyelid, but you will feel how the skin is drawn in around the eye and forehead. It is this action that gradually forms crow's feet around the eyes. We needle this point to lift the top of the cheek and to benefit the eyes. Needle size 15 by 0.20 mm, 36 gauge. Technique: Evans and needle bilaterally. Consider for orbital neuralgia, feeling of smoke in the eyes, poor distant vision, trigeminal neuralgia, sinusitis, rhinitis, or facial paralysis. Its alternative name of grain gate refers to the mouth, which is the gate of the stomach. Stomach, a Greek word, also means the mouth. We have just discussed the location of the points used on the front of the face.